Hello, my name is Jose Castillo, and I'm going to be validating for airway management suctioning today. The first thing we do is we verify the prescriber's order, and so we go into the patient's record and we see that the prescriber has ordered suctioning for this patient. We assess for the procedure need. We make sure that this patient actually needs the procedure, and we can confirm that. Then we walk into the patient's room. We perform hand hygiene. We don gloves, and we can introduce ourselves to the patient. We make sure we're wearing our PPE, which I'm already wearing. We provide the patient with privacy. That's very important. We also need to identify the patient. So the way we do that is we check the patient's wristband, and we ask the patient for his date of birth and his name. So once we do that, we can also explain to the patient what we're going to be doing. We can tell him we're going to be suctioning him, that we're going to be removing some of the sputum he has in his trach, and hopefully he will be breathing a little better soon. We also perform safety, so we make sure the bed wheels are locked. We make sure that the rails are up and that the patient is fine. We also have to assess for the patient's vital signs. So we can say that the patient has a blood pressure of 120/80. His heart rate is at 75. Oxygen saturation at 96%. Breathing is at 14 breaths per minute. And after we listen to the patient's lungs, we figure that there's some rhonchi sounds coming out of there. Because this is a trach procedure, we are not going to be able to be verbal with the patient, so we have to create a signal in order to communicate with the patient. So I have asked the patient if he feels any kind of pain or any kind of discomfort to just raise his right hand. We again perform hand hygiene. We don gloves. And for a procedure like this, for suction, we need to make sure the patient's bed is high up. So we want it either in a semi-Fowler's or a Fowler's position. We also have to keep in mind that we have to hyper-oxygenate the patient because we're going to be removing the patient's oxygen for a little bit. So that's the next thing we do. We take out the oxygen mask and we hyper-oxygenate the patient. We turn on the suction device. We make sure everything is working properly. We make sure we have our supplies in front of us. And we also need to know that the pressure for the suctioning device should be at 120 millimeters of mercury. We open the suctioning kit, which is right here. After we do that, we need to don sterile gloves. My gloves are right here. We can touch the outside of the glove while we put them on. We do the same for the other glove. Because I'm wearing the other sterile glove, I can actually fix it better. Make sure this hand is good. So once we're sterile, we're gonna grab the catheter. This is gonna be my sterile hand. This is gonna be my dirty hand. We're gonna put some regular saline, the normal saline, into the basin. It's gonna be my dirty hand, so I can catch this part with a suction device. We're gonna prime this part inside of the kit. This is the kit. Inside, we're gonna prime it. Then I'm gonna connect this side into the suctioning device, which, like I said before, should be in the back of the patient's bed. And then what we're gonna do is we're gonna actually, when we check that the equipment is working, after we confirm that, we can put the catheter into the patient. I am using like a can just to say, so you can see it. So we advance the catheter until we feel some resistance or if the patient starts coughing. Once that happens, we have to take out 1 to 2 centimeters out. And after we do that, we start putting the catheter out in a circular motion and starts hitting the suctioning button intermittently until it's out. This should last for 10 to 15 seconds. So what we did was the motion was like this, intermittently here and circular, just to get it out. After that, we asked the patient to cough a little and to breathe, to deeply breathe. And we have finished with the suction. The next thing we do is we need to document what happened. So the first thing we do is document the date and time. So we're gonna say it's 10 a.m., September 23, 2020. We only suctioned the patient once. We can say that the patient's oxygen saturation improved to 98%. It was at 96 before. And his breathing also improved a little. It was at 14 breaths per minute, and now it's at 16 breaths per minute. We can also say that right after the procedure, we did hyperoxygenate the patient again, and we did it before too. So we did pre and post. We actually put the mask, the oxygen back into the patient. We can also say that that we found a small quantity of bright yellow sputum. That was what we pulled out of the patient. No particular odor. What we can also do in order to prepare the patient for the trach care is we remove the gauze, the dirty gauze that the patient had on. We can remove it with the dirty glove. This is actually my dirty glove, and we can remove it.